And new tonight, you'll soon be able to get a simple blood test to find out if you have the second deadliest cancer. It was just approved by the FDA. According to the American Cancer Society, 53,000 people will die of colorectal cancer this year, and less than 60% follow screening guidelines. A local surgeon tells me he hopes this new screening tool will change that.
I'm very happy that we have an additional tool in our toolbox to help people get screened for colon cancer.
Dr. James McCormick, who's the chief of colon and rectal surgery at Allegheny Health Network, is excited the FDA approved a first-of-its-kind blood test to screen for colorectal cancer. It's meant for people 45 and older.
You just get your blood drawn, and what they're doing is looking in the blood for circulating tumor DNA. So DNA that the tumor will have released into the blood, and it would be able to detect that.
In clinical trials, this test was 83% accurate in detecting cancer that's already formed, but it's not a replacement for colonoscopies. Any positive result would then require a colonoscopy.
So it's different from a colonoscopy, where we can take precancerous tumors at the time of the colonoscopy and remove them before they can become cancerous tumors. That's still the best screening test. And really the only test that you should have if you have any symptoms at any age.
Dr. McCormick says everyone should be screened for colon cancer at age 45, but 20 or 25% of people never get screened. He hopes the Shield blood test will help boost the rate of screenings and save more lives.
If there's a reason that they're not getting screened that is solved by the Shield test, then we'll take it. We'll get them in that way.
The test approval comes at a time when more people have been developing colon cancer and at younger ages.
We're even seeing patients in their 20s and 30s with colon cancer, even with no family history, and we have no idea why or who is going to be affected by this.
Dr. McCormick says never ignore symptoms. If something is different, fight for yourself and make sure you get the test you need.
So anytime there's bleeding, anytime there's abdominal pain, anytime there's a change in the way your bowels work, that persists more than just a few weeks, definitely call your doctor and insist upon getting a colonoscopy.
And he's talking about anyone at any age. There's a third screening tool that's available, which is a stool test. Dr. McCormick says if a blood test and a stool test are negative, those would likely be repeated every 3 years. And negative colonoscopies only need to be done every 10 years.